Good evening and welcome to the program Easy Access to Healthcare for All. This program details events and activities in and around the National Health Insurance Authority (NHIA) and indeed the health insurance ecosystem. It is a season for stakeholders' engagement in the NHIA as the Health Insurance Authority takes steps to put everyone on the same page, especially with the new NHIA Act. The latest engagement of the authority is with healthcare providers and with chief medical directors of federal teaching hospitals and federal medical centers. These key stakeholders were kept abreast of new reforms like the new provisions of the Act, Medicine Supply Initiative, and several others. These is in addition to challenges being discussed and solutions that will move the health insurance ecosystem forward and proffered. Join me after the break for the full package. My name is Aisha Muhammad Ahmed, your regular anchor.
President Muhammad Buhari has signed the new NHIA Act into law, which makes health insurance to be mandatory in Nigeria.
One of the reasons why we decided to gather here,
familiarize ourselves with the content
of the Act, is entirely a watershed, a new beginning.
It's going to be a transition between the National Health Insurance Scheme to the National Health Insurance Authority.
And then start preparing for how we are going to implement it.
We begin with a highlight of events around the NHIA. In the news, NHIA restates the importance of the media in popularizing its activities, just as stakeholders in Jigawa praises the NHIA Medicine Initiative.
Director General of the National Health Insurance Authority has said the media is a partner in the health insurance space and will help disseminate information about the scheme to the unreached. He said this at a press conference held in Abuja on Tuesday, the 2nd of August 2022. The event was a medium to enlighten Nigerians on the developments within the health insurance ecosystem, as well as clarify issues around the new NHIA Act.
There is no way we can succeed as an agency of the government or any agency of the government without carrying the media along. And this program that we are running, the National Health Insurance Program, it is a program that it will help and assist all and sundry, irrespective of their socioeconomic status. But the most critical people in the health insurance business are those people that cannot afford to pay for the services. And that's why the hallmark of the social insurance scheme is cross-subsidization. How do you aggregate resources to cross-subsidize for people that are poor, for people that cannot afford to pay?
Professor Sambo said the new NHIA Act is a game changer in the healthcare delivery system of Nigeria. He gave some highlights of the new NHIA Act.
Henceforth, any communication with us should contain National Health Insurance Authority, not National Health Insurance Scheme. More so, the nomenclature of the Chief Executive Officer of the organization has been changed as well. From the what we used to know, the Executive Secretary, to now Director General. Some modifications have also been made in the content of the governing council of the authority to ensure that people that are being regulated are not part of the board. One are not part of the council. One of the paucity of the other of the law before, it made a provision in the governing council. The people or the group of people that are supposed to be regulated, they are part and parcel of the board. And therefore, they always have undue influence on whatever policy that will come out from the organization.
stakeholders have applauded the NHIA Medicine Supply Initiative, describing it as a move that will strengthen the health insurance process further. They made the commendation during a one-day sensitization on the new NHIA Medicine Supply Initiative, which held in Jigawa State, one of the pilot states for the initiative.
I think the authority got it right by bringing this issue, engaging with different stakeholders that will ensure sustainable drug supply system in the system. So for this, I say kudos to National Health Insurance Authority.
At the event, pharmacist Al-Hassan Yusuf of the Standards and Quality Assurance Department gave a presentation on the initiative.
The initiative came to be to correct the perception that the LODs tend to have when they go to assess their medications.
The NHIA Medicine Supply Initiative targets 3 core areas, including branding of drugs, cost sharing, as well as innovative financing in order to give drug security to enrollees.
The program is Easy Access to Healthcare for All, a program that brings you highlights of news and happenings around the National Health Insurance Authority. To ensure strategic involvement of stakeholders in decision-making, the authority has created a platform where key implementers of health insurance meet. It is a forum where players interface and discuss emerging developments as it affects health delivery processes. Recently, 2 stakeholders' engagements took place and various issues were discussed. We bring you highlights of these events in our next segment on the issues. Do stay tuned.
A strategic stakeholders engagement with healthcare providers and chief medical directors of federal teaching hospitals as well as federal medical centers held in Abuja. The meetings had in attendance representatives of both stakeholders across the country. Both forums served to keep stakeholders abreast on emerging developments within the NHIA and also provides an avenue to discuss issues that affect the health insurance ecosystem. At the meeting with the healthcare providers, Professor Nasir Mohammed Sambo, Director General NHIA, gave the opening remarks, while he said the forum is in line with the NHIA Stakeholders Coordination Framework called Health Insurance Under One Roof, which is also part of the NHIA rebranding agenda.
In our last meeting in February 2022, we briefed you on the progress with some of our routine activities and the institutional reforms that we have been embarking upon. Today, we will be giving you some updates as well as the issue of the National Health Insurance Authority Act, which has just been amended by Mr. President.
Professor Sambo noted that with the assent of the new NHIA law, the authority felt the need to enlighten key players to help make its implementation seamless.
This kind of capacity building was not there at the point when the first law was signed into law. So it was signed, and so there were a lot of knowledge gap in the process of implementation. But we wanted to avoid this kind of situation whereby people will be playing a football without knowing the rules and regulations governing it. And it is in this spirit that we try to bring up this meeting, so that we can take you through the content of the law and know your rights and know your obligations. At the end of the day, we are going to have another document which is going to be an operational guideline that will translate every aspect to a granular level, so that every item of that law is fully understood by the players.
There were various presentations which commenced with the journey to mandatory health insurance in Nigeria, comparative analysis of the NHIA versus NHIS Act by Blessing Nyenge, GM Legal Services, NHIA.
The overview of the NHIA Act will be looking at the introduction, the steps that we took before we were able to get this act signed or assented by the President of the Federal Republic of Nigeria, the components of the act, highlights of the act, and of course, the role that you will have to perform to ensure implementation of this act. We will look at it at a glance. Because talking about your roles are wide, and without your roles properly played, we cannot achieve what we are looking at.
Another presentation was on the National Health Insurance Authority Act 2022, Strategic Roadmap for Implementation. It highlights strategy for the implementation of the new NHIA Act by the authority.
And the contribution is proportionate.
Stakeholders were further enlightened on the importance of the new NHIA and its mandatory nature. Similar presentations were made during the stakeholders' engagement with the Chief Medical Directors of teaching hospitals and federal medical centers, with Professor Nasser Sambo starting off the sessions. He stressed the importance of the forum, bearing in mind that providers are key players in the implementation of the new Act. He urged all hands to be on deck in order to collectively design a strategy for implementation.
It's imperative that we bring all the stakeholders, all key stakeholders, to have a very close engagement with them so that they can appreciate what is the content and the context, and probably the process that we will follow in the implementation of this very law. Because this law is so overarching that NHIA is not the only responsible body to ensure its implementation. The health insurance ecosystem is a very large ecosystem with multiple stakeholders and multiple connections. Therefore, it is important that all of us should come together, go through the content of the bill, appreciate it, then collectively design a mechanism that will ensure a successful implementation.
Chief Executive Officers also got to hear about the various initiatives and reforms, including the Medicine Supply Initiative as well as the ENHIA. In fact, stakeholders were asked to align their operations to fit into the ENHIA, with a presentation on connecting to ENHIA interoperability, technology, and standards by Joseph Amakuro Gbongmo.
If I have to go to Garki and tomorrow I find myself in my village, there should be a medical history that they can build upon if we are interconnected. So it enables different information technology systems to communicate and exchange usable data. This allows providers to have access to all data for a patient being treated. And this helps a lot. It fast-track treatment. It fast-track understanding of the medical situation of your patient. Next slide, please. So when we say in healthcare, it describes the notion of distinct information systems working together within and across organizations to advance effective delivery of healthcare to individual communities. So you are interconnected. There are handshakes, data exchange, so that we can get effective delivery.
Another intriguing presentation was on establishing a credible managed care unit by Dr. Adamu Onu, CMD, NISA, Garki Hospital, Abuja. A reflection of the progress made by Garki Hospital by operationalizing the NHIA manual.
What did we do? Well, prior to the period when we started our reforms, we looked at the situation in the hospital and we discovered that there was a lot of confusion, there was fragmentation, there was waste of resources, inefficiency. We had patient dissatisfaction, a lot of patient anger, and we also had a high volume of denied claims, refused claims from the HMO. So that was the situation at that time. And we wondered what could have been driving it, what could have been the root causes of this situation. And after undertaking a study, we found out that the main reason was a lack of operationalization of the operational guidelines at the level of the hospital.
One thing that the forums ensured was that stakeholders were all on the same page as to why the NHIA is and why it is headed, as well as the various roles each one must play to make sure Nigerians get the best of health insurance.
Welcome back from that break. The program is Easy Access to Healthcare for All, and it continues with our stakeholders segment. In this episode, we spoke to participants during the strategic engagement the NHIA had with heads of healthcare facilities as well as CMDs. Most of those spoken to described such meetings as a good development.
I think this was actually a very good idea. And in our previous interactions with the DG of NHIS, we interacted with him as an exco of the committee of CMDs, but was a need for us to have this bigger house where we can have all the CMDs under one roof. To first and foremost understand this new NHIA Act and all the different changes that have been brought to NHIA. I think it was a very, very rewarding interaction, and there's no doubt that it would help us in our operationalization of NHIA in our various institutions.
Okay, it's a very welcome. In fact, when I heard about it, because I've heard about the new act, the NHIA, no more NHIS, and the state offices, they've really been engaging us. We've been going for a series of reconciliation. So to hear about this stakeholders meeting, I was really excited. And the sessions we've been through so far, the DG started with the 10-point agenda. In fact, when I was taking notes, in fact, to me, it's more like a 15 or 16-point agenda that the NHIA have been able to bring to bear or to fulfill.
Healthcare providers praised the authority for creating a forum to meet and discuss with healthcare facilitators. These, they say, will improve quality of service given to enrollees.
The new NHIS Act is one of the transformative actions in the health sector in Nigeria. The main thing is to see how Nigeria can achieve universal health coverage. And you cannot achieve that if social health insurance is, if we cannot achieve that if social health insurance is voluntary. And so with this act that all Nigerians will be covered is key for us to achieve universal health coverage. And I think it's one of the fundamental achievements in the health sector in Nigeria so far as I'm concerned.
The act, which was signed by the president, thanks to him, is, we hope, something that would revolutionize the health industry, because it addresses a lot of the issues that we're missing with former act. So this meeting
is critical to its implementation, because salient points have been brought out. The highlights of the Act were brought out, and critical questions were asked, and I think that places us on the same page, and that should make the implementation smoother.
Some applauded the NHIA for reforms that will make interoperability and integration of health insurance processes seamless.
There are some other innovations that the NHIA are currently doing, particularly the NHIS is going to connect virtually every healthcare facility, every state office of NHIA, likewise the HMOs. So we are going to have one platform within which to operate, and it will be very easy to see to the end of some of the fraud that actually go on with the old scheme.
There are quite a lot of innovations that are coming up, which I believe, when fully implemented, will help Nigeria to get closer to achieving universal health coverage. I'm quite excited at what I'm hearing today and the plans they have, the management of NHIA has, towards making health insurance the next road to universal health coverage.
Some other stakeholders were full of commendations for the new leadership of the NHIA.
It's a wonderful thing the association has done and the government has done. The place of national health insurance cannot be overemphasized if you must have universal health coverage. So I want to applaud the executive secretary. I want to applaud the whole institution, and I want to congratulate all Nigerians for getting this act on board.
Stakeholders in the NHIA there commenting on the constant engagement with the authority and other newly introduced initiatives to improve performance. And like you heard, it is commendations all the way for the new wave sweeping over health insurance. We will now take your questions next in the last segment of the program.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled? How can I get enrolled?
Question: how do enrollees access specialist care?
For specialist care, the enrollee will first attend at their primary provider, which in NHIS parlance we call the gatekeeper. So you go to your doctor where you have registered, and then the doctor, if sees anything necessary, will refer that enrollee for a secondary service. If the hospital offers that service, then there will be an internal referral. However, if the hospital does not offer that service, then it's referred to a center where that service is offered, and the hospital, therefore, in both cases, the hospital will actually get in touch with the health maintenance organization, who will actually issue the referral code, and then the hospital gives the notification of the referral to the patient, who either goes to the internal place if the hospital offers the service, or goes to the other service provider that actually offers that specialty service.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled? How can I get enrolled?
With this, we've come to the end of today's episode of Easy Access to Healthcare for All. Please join us next week, same time and same station, for another interesting package. See you next week.